Hello, my name is Dr. Laurence Dorman, and I'm the chair of the Royal College of GPs in Northern Ireland. GPs in Northern Ireland responded quickly, showing off their adaptability and flexibility within the pandemic, and we really impressed the Department of Health of how quickly we got things in place to keep our practices safe, our staff safe, and ensure that secondary care services weren't overwhelmed throughout the pandemic. Within 10 days, we established our first COVID assessment centre, and these COVID assessment centres enabled our practices to separate hot from cold and enabled hospital services to be protected by treating patients safely in their community. On the basis of this, it is seen through the Department of Health Northern Ireland that general practice and primary care must have a greater primacy within healthcare going forward in the future. We're very keen to influence and to show our experiences to all in authority, and we will continue to do so. One of the key areas in general practice in Northern Ireland that we want to promote and we want to see embedded fully is the implementation of multidisciplinary teams in Northern Ireland. These MDTs would see in our practices first contact physiotherapists, social workers, and mental health practitioners. This would revolutionise care in Northern Ireland. So instead of the GPs having to do everything, patients would directly book in with these professionals, and these professionals would be housed under the one roof of the practice. Monies has been set aside to expand our practice buildings, and there will be good accommodation provided to help enable all these services to be held under one roof. So the soft exchange of information that happens naturally in a practice during coffee breaks and so on can continue to do so. New health professionals as well will be encouraged to work proactively. So our mental health workers, for example, could look at our lists of patients with significant mental illness and be able to engage with them, preventing them getting sick. So we would change away from the current model, whereas where we expect health crises to occur and present to our health service, this would be more of a preventative model and one that we support fully. The model would also see the increase in numbers of district nurses and health visitors, and we see these as crucial key community workers who help prevent health inequalities, particularly with our health visiting colleagues who can identify families who are struggling and can link in with practices, and most importantly with local community services. Normally in most towns and villages, I, like my other colleagues, find that there are a multitude of voluntary and community services that we simply are not aware of, and these new members of our team are very skilled at knowing how to navigate these, and we badly need them in our teams. Like with general practitioners across the UK, GPs in Northern Ireland are finding the way about what is the right balance between face-to-face and virtual consultations. GPs in Northern Ireland have found that while telephone consultations can have their advantages, they certainly are not quicker or more efficient in a lot of cases than traditional face-to-face working. We find that telephone triage is not a true term of triage, where triage should be quite a quick process, but telephone contacts with patients are just frequently consultations. So we're keen to find the balance between how we adapt our services to offer the best care for our patients. What we do anticipate is that there will be a more remote front door to our patients, but this then will allow our patients to have a menu of access right across our health service offerings. This menu can involve certainly face-to-face or remote working whenever that is appropriate for our patients' needs. To enable us to address all these things, Royal College of GPs in Northern Ireland is lobbying hard with government and commissioners to ensure that we have sufficient general practitioners to meet the needs of our population. Before the crisis, GPs numbers in Northern Ireland were not good, and we were looking at a significant shortfall. We do see ourselves, however, as masters of our own destiny, and we intend to address this need by investment in education. In Northern Ireland, Queen's University, who will be our largest supplier of medical students, have changed their curriculum to make it more general practice focused, and we relish the chance to educate these new potential young doctors. To do this, however, we will need resourced, and we will be promoting this and pushing the Department of Health to enable us to do this. We also have a new University of Ulster, commencing a new medical school curriculum, which again will be aimed towards general practitioners and primary care focus, and we again want to engage and play our part in helping to deliver this, but we will need support to be able to do this. We are in the college, we are promoting general practice as a career like never before. We are trying to engage with our undergraduate students and in our schools, and we're highlighting what a rewarding and varied career general practice can be. we very much see ourselves as the solution to our own workforce problems, and education is the way to do this. We also see technology as a way of enabling practices to meet the future demands. We have seen how having a remote front door can help, but we also see technology having wider implications. We are very keen that electronic prescribing is rolled out across Northern Ireland, which will give benefits to patients through efficiency of journeys, through safety of prescribing, and benefits to GP practices with efficiency and time resources. We see technology as very important in terms of data analytics and how these can be used to truly shape our services where our patients need them most. GPs must be involved in these conversations, and we are promoting actively that we get true opportunities, the same way as our hospital colleagues, to train up our brightest and best GPs into these new skills. We must see sustainable funding come to general practice, and we are pushing the Department of Health to make sure that monies that come into schemes such as MDTs are recurrent sustainable funding models. So we are doing a lot in Northern Ireland to promote general practice. We still believe it is the best job in the world, and we will continue to sing its praises for whoever will listen. Thank you.